Hello guys, Jesse here. We're going to cover color Doppler today. We're going to cover the physics part of it, what it has to do with the image, how to get the correct image, and what it has to do with the blood flow, the velocity, and how to get the accurate measurement. The first thing I want to cover is what is Doppler. A great example of Doppler would be, for example, an ambulance. As the ambulance is traveling towards you, you hear a high frequency, like a short wavelength, like you hear real loud as it's coming towards you. And as the ambulance passes you, you hear the sound fading away. Like the frequency starts getting less, the wavelength becomes longer. So the further it gets, the more distinct or more shallower the sound is heard. Basically, that's what we could say about Doppler. Basically is the shift in frequency on a moving object while somebody is stationary. So a great example, like I said, ambulance, a motorcycle, a train, anything that's creating sound that is moving while you are being stationary. The next part of Doppler I want to cover is color. So Doppler color. Color has a lot to do with the velocity at which the blood cells are traveling within the vessel. It is important to know that Doppler color determines velocity, not speed. Speed is basically as simple as it can be, a car going 50 miles an hour, whereas velocity means the car is going 50 miles an hour heading south. So the same for the blood cells. It would be the blood vessels are going 100 miles per hour. That's speed. Now, if I say the blood vessels are traveling 100 miles per hour towards the heart, then that would be velocity. It's important to know that color Doppler is measuring the blood cells' velocity, not speed. Another thing color flow is used for is to determine antegrade or retrograde flowing. Antegrade meaning basically the blood is traveling the way it's supposed to through a vessel, and retrograde meaning the blood is not traveling the way it's supposed to through a vessel. Where there's, for example, a vein reflux, meaning the blood's going back into the veins when it's supposed to be heading forward or towards the heart, it's actually going back into the vein. For example, a femoral vein, supposed to push the blood back to the heart. When retrograde happens, means that the valves of the vein are closing enough and allowing blood to come back into the vein, which that's retrograde. And like I said, antegrade means blood is going towards the destination it's supposed to be going, and there's nothing wrong with it. Okay, guys, so color map. So this is the color map that is displayed on the monitor when you are doing color Doppler. So basically what this is the most specific that it could be is the top portion of the baseline, which the baseline is that black part right there. Anything above the baseline means that it's heading towards the transducer. We'll explain that later as far as the angles on the transducer, but anything above the baseline is towards the transducer, and anything below the black line is away from the transducer. So the top and bottom doesn't mean that the bottom is veins or the top is artery. It could be the opposite. Red does not mean artery. Blue does not mean vein. Blue could be on top, red could be on the bottom. It's still the same thing. So if blue was on the top, it would be saying that the blue means that the blood is traveling towards the transducer, and the red, if it was on the bottom, it would be the blood is traveling away from the transducer. So that's do not get colors mixed up. The next topic I want to cover is the transducer. It's very important to remember how the transducer is supposed to be positioned towards your patient. For example, the notch is supposed to be on the patient's right, not your right, the patient's right, when you're doing a transverse scan. And when you're doing an axial scan, which is important in color Doppler, it's always important to remember that the notch is supposed to be towards the patient's head. If not, that's going to get things confused, where you're going to you might flip velocities, or you might be distinguishing something that it is not. So always remember the notch when you're scanning in sagittal towards the patient's head, and the notch towards the patient's right when you're covering transverse of that vessel. Okay, guys, while we're here, we're going to talk about Doppler shift, because it has a lot to do with the velocities of the blood and a lot to do with the color map. So the Doppler shift basically means, well, I'm going to put it in an example. Let's say the transducer is shooting 2 million hertz sound or pulse. Basically, it's going to strike the vessel or the blood that is traveling through there, and the blood is going to send a signal back to the transducer, and that is called Doppler shift, and it determines the frequency. It's okay. So back to it. The transducer shoots a 2 million hertz pulse towards the blood vessels. The blood vessels are then going to send another pulsed frequency back to the transducer. Now, if the pulse was 2,003,000, then the pulse would be regarded as a positive shift, which then would be located on the top of the baseline. And if the transducer shoots 2 megahertz pulsed sound, and the blood vessels return a 1.8 megahertz pulse back to the transducer, that means it's below the baseline. So let's say we start at 2 million hertz. From there, whether it's a greater number, that means the blood vessel is traveling towards the transducer, and if it's a lower response than 2 million hertz, then it means it's below the transducer. Below the color map, which means it's traveling away from the transducer. This is a good example of what I meant by antegrade, which means the blood flow is trying to go the way it's supposed to, and there's no reflux or anything like that. So here we have a femoral artery in red and a femoral vein in blue. So basically, the artery is traveling away from the transducer towards the lower extremity, and the femoral vein is traveling towards the heart, which means traveling towards the transducer. Another thing to know is when you see this angle box here, you draw two lines heading down from these top corners. Draw two lines going straight down. One would be here and the other one would be here. Whichever line is outside of your box determines where the linear transducer is at. So right here, the top of the transducer would be on this side because that line is outside of that box. So meaning, if this is correct, if the transducer is placed correctly, that means that this top part is towards the patient's head and this bottom part is towards the patient's feet, which is the way the transducer is supposed to be set up. So here, the artery would be traveling away from the transducer, and the femoral vein would be traveling towards the transducer because of that imaginary line here, knowing that the transducer notch is towards the patient's head. So that would tell you that this is going towards the transducer and this is going away from the transducer. So when scanning with Doppler, for color Doppler, it is very important to get the transducer as parallel. What I mean by parallel is this image right here, to the flow of the blood flow. So if the vessel is traveling at an angle, you cannot hit the You cannot hit the vessel at a 90-degree angle because that would not be an accurate at all Doppler shift. If the vessel's traveling up and you angle or you heel toe your transducer to get an angle of at least 60 degrees or less, when we say 60 degrees from the skin to the top of the pen. So the more you heel toe and try to get the velocity of that blood, the more accurate it's going to be. So if my transducer is at 60 degrees, if my transducer is at 60 degrees, the velocity is not going to be as accurate as if it were at 10 degrees. This is a perfect example of to measuring blood flow. This is another example right here as what I mean to heel toe your transducer to get the correct or less angle from the transducer to the blood vessel. So the more parallel you have it to the flow, the better the result, the velocity is, the more accurate it is. Another thing about Doppler shift is it is directly related to velocity and frequency. So if either one goes up, velocity of the blood, or the frequency of the transducer, the Doppler shift will increase as well. Next thing I want to cover, guys, is the Nyquist and aliasing effect. So high frequency transducers are more subject to Nyquist and aliasing effect. This image right here shows what aliasing effect means. Basically, it's showing that there's blood flow going towards and away all different kinds of directions within that vessel. That happens when your color flow adjustment is too high, which is easier to do this in a high frequency transducer than in a low frequency transducer. Basically right here, this line is a red line is the Nyquist frequency limit, meaning any frequency above that line is going to cause this, the Nyquist frequency. So for right here, the high frequency transducer, if you put it high enough, it's going to go above that line and it's going to cause this. Low frequency transducers have a less chance of exceeding that limit. Therefore, it is very less likely that it's going to cause the Nyquist frequency.